Occupational English Test. Practice Test 5. Listening Test. This test has 3 parts. In each part, you will hear a number of different extracts. At the start of each extract, you will hear this sound. You will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Emily Montgomery. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Thank you for coming to A&E. I've already taken a full history and examined John. We have a diagnosis and we're working on your son. If it's okay, I'd like to ask you a few questions, please.
Yes, of course.
I understand that John has been in pain.
Yes, the pain kept him from sleeping.
How long has this pain lasted?
4 hours, I think.
Any other symptoms?
Yes, his father says he vomited twice. Could this be food poisoning? Because I had some a few days back.
No, it's not food poisoning. I understand that he's had a similar event before.
Yes, about 6 months ago, actually, but the pain went away very quickly.
What happened on that occasion?
Well, the pain came on suddenly in the morning and it lasted for an hour or so. And he was balled up in pain, like in a fetal position. But he didn't vomit. I think the pain went away on its own.
I see.
And he's also asthmatic and uses salbutamol inhaler. Could that be the reason for this pain?
It's unlikely, I'm afraid. I've examined John. His right testicle is extremely swollen and tender compared to the left. He is missing something. It's a reflex that happens when a male's thigh is stroked. It causes the testicle to contract. As this reflex is missing, John has testicular torsion until proven otherwise. Regarding that episode 6 months ago, it's actually likely that he had an intermittent episode of testicular torsion that resolved itself.
Is it serious, this testicular torsion?
Potentially, yes. Testicular torsion occurs when the testicle rotates. It twists around the cord that brings the blood to the scrotum. This reduced blood flow causes sudden and often severe pain and swelling. If it's treated quickly, the testicle can usually be saved, but when the blood flow has been cut off for too long, a testicle might become so badly damaged that it has to be removed, which is why we're acting to treat him so quickly.
Oh, God, no.
Please be reassured that John is in the best possible hands and a good outcome is expected. He needs surgical exploration as soon as possible, or else lack of oxygen to the testes can occur after approximately 6 hours. We already have consent from John's father to perform the surgery, but we wanted to update you just in case you want to see him before he goes into theatre.
Okay, thank you.
There is one more issue. I hope I can speak freely.
Yes, of course.
We found signs that John may be sexually active.
What?
Yes. We suspect that he has a condition called epicarditis, an infection. We've sent the urine samples off for screening. We suspect an inflammation of the epididymis, and it's usually due to infection, most commonly from a urine infection or an STI. A course of antibiotic medicine will usually clear the infection.
Oh, now I'm just worried. I mean, I want him to be able to have children after this.
And he likely will. I mean, we can't admittedly say the cause of infection if there is one. When the tests come back, we'll know for certain and we can manage the situation.
Extract 2. Questions 13 to 24. You hear an A&E doctor talking to a patient called Megan Armstrong. For questions 13 to 24, complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Thank you for being so calm. The last 24 hours can't have been easy. Just let me reassure you that your daughter is fine now and that she's been given some adrenaline.
Thank you. Oh, it all happened so fast. 1 minute she was eating her dinner at the party and next she collapsed on the floor.
Do you know what she ate?
I'm not sure. We'd been asked our dietary requirements in advance and I specifically asked for a vegan dish. The party was catered for by a caterer that I didn't know, so I didn't want to take any chances. My daughter's 4 now and she's always been allergic to prawns and shellfish, neither of which should have any place in a vegan dish.
I suppose you haven't had much time to ask the host.
No, none at all. I rushed straight here and we've been here ever since. They admitted us straight away and rushed us into A&E. They said they'd run some tests, find out what caused this, and I just cannot stand not knowing.
Don't worry, we will find out. Now, there are a number of diagnostic tests that will let us know what the allergen was.
Allergen?
Yes. We don't know for sure yet, but I suspect that your daughter's had an allergic reaction to something that she ate.
Why? I mean, what would cause that?
A variety of things, really. It's her body's immune system protecting her from something it thinks is toxic. It usually passes with a bit of water and rest, but sometimes an allergic response can be very serious.
Like death?
Right.
Well, once we find out what it is, I will make sure that my little girl never eats that again.
Certainly be advisable to avoid it, yes.
At least now I know what to do if it does happen again. Yesterday I was just so busy flapping about. It was actually one of the other mums that suggested I bring her here. I was just so upset.
That's understandable. And she did the right thing.
I just really want to know why it happened and what to do if it ever happens again.
Well, I can make inquiries and I want to see if we can get you an EpiPen. Have you heard of that?
No, what's that?
It's an auto-injector that gives a small dose of adrenaline, and it's only to be used in case of an anaphylactic shock or other allergic emergencies. You need to give it, for example, in the abdomen, thigh, or lower back, and it will give you a chance to let the paramedics arrive.
Right, okay, I'll bear that in mind then.
It's probably for the best.
Will I always know when she's in shock? What if I don't realise?
Now, it should be clear, but it may not always be, actually, because some of the symptoms to look out for include flushing of her skin, swelling of the lips, throat and mouth, difficulty swallowing or speaking, abdominal pain, nausea and vomiting.
All right, thank you for explaining all of that. I'll have to let my husband know then too, and I suppose everyone else really. I don't think many of the other mums know that much about how dangerous allergic reactions can be. I mean, I almost lost her.
But you didn't. You did the right thing, you rushed here, and we're treating her.
Yeah, no, I know you're right, and I am so grateful for all of your help. I just, cannot wait to find out what this allergen is, just so that, she can avoid it in the future. And I'm going to tell all the other mums to be careful, because, like I said, I almost lost her, and I just don't think they realise how, how serious it is.
Of course. I'll get you some pamphlets on what to look out for, and maybe you could pass them to some of your friends as well, so that they know what signs to keep an eye on.
Yeah, I'll definitely do that. Thank you so much.
No problem.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 1 to 6, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Test 5. Now look at question 1. You hear a podiatrist discussing how she prepares for a consultation. Now read the question.
I'll bring the patient into the room and sit them down, and I'll start off by taking a full medical history, including any medical conditions, any medication they might be taking, and asking if they have any allergies. After this, I will ask them to explain to me why they have come to see me, and I'll make notes about that so that I've got all the information written down. Sometimes I have a referral letter from a surgeon or a doctor, and if I do, I will refer to that throughout the consultation as well. Once we've finished talking about why they've come, we'll then move over onto the patient chair, and that's when we will start the examination.
Now look at question 2. You hear trainee speech pathologists discussing a staff retreat. Now read the question.
How was the retreat?
Good, yeah. Shame you couldn't make it. We went to the Lake District.
I know I had a family emergency. Was it just an excuse to have a holiday, or did you actually get some work done?
It was actually really helpful. We talked about exploring using phonics to overcome cognitive impairments. As I'm sure you can imagine, having somewhere really peaceful was helpful to practice.
I'll bet. So how does it work? Using phonics, I mean.
Oh, it's all to do with forming relationships. If you can relate a particular memory to a particular sound, for example, it makes it so much easier to remember the details more clearly. For example, a loud clap in the middle of a murder scene may help you to remember the face of the culprit.
What?
What's so funny?
Just that I'd love to have seen that. You all stood in the middle of the district making fools of yourself.
Hey, watch it. But seriously, it was great.
I'll bet.
Now look at question 3. You hear an extract from a talk on brain cancer. Now read the question.
Glioblastoma multiforme is a very aggressive and malignant form of brain cancer due to its high resistance to chemotherapy. Of recent, it has been found to depend on the bulk of macroautophagy to boost proliferation, though modulators of autophagy hold great potential as chemotherapy adjuvants. The degree of inhibition or upregulation necessary to achieve apoptosis sensitization remains unknown. Hence, the study by Jürgen et al. Aimed to determine the extent of autophagy modulation required to cause an impairment of mitochondrial bioenergetics to the extent of enhancing the onset of cell death. Results showed that coordinated upregulation of autophagy, followed by its inhibition before chemotherapy, caused a decrease in oxidative phosphorylation and election transfer system capacity, impaired fission of the mitochondria and fusion dynamics, and also enhanced onset of apoptosis in terms of cleaved PRAP expression and cleaved caspase. Hence, coordinated modulation of autophagy may present an avenue favourable for improved chemotherapeutic intervention in the future.
Now look at question 4. You hear a physiotherapist consulting on fatigue. Now read the question.
So, you're here because of your fatigue. Are you feeling pretty fatigued at the moment?
Yeah, I'm exhausted. Even just getting here today was a struggle. I'm so grateful for everyone's help, but to be honest, just sitting here and talking to people in these appointments wears me out.
Okay, well, what I'll do is I'll spend about 15 minutes right now seeing what I can do to help you. I'll also give you a booklet to take away, and then we can arrange an appointment for you to come again the next time you're in clinic, if that would help. How does that sound?
Yeah, anything. Thank you so much. It's just draining and it's all the time now.
Oh, I'm sorry it's so bad for you at the moment. A lot of people get this during their treatment. It's pretty normal. But there are lots of strategies that can help.
Well, that's reassuring to hear.
Now look at question 5. You hear a dietitian reporting on research. Now read the question.
My research interest is the nutritional problems of developing countries, which I theorise are caused by their inhabitants' near exclusive reliance on plant-based sources of nutrients. When combined with low socio-economic conditions and consequent high rates of inflation, it is an area of nutrition whose exploration could save nations. Control of these nutritional diseases requires thorough analysis of the existing situation and appropriate, cost-effective and innovative strategies to fight the spreading conditions of abject poverty. One such example of this was the 2010 French mass production of plum peanuts, a cheap peanut-based paste that is still being used as treatment for severe malnutrition. This cost-effective paste allows immediate remedial action to be taken in regions that would otherwise require mass-scale aid and costly intervention.
Now look at question 6. You hear a group of radiographers discussing a spirometer. Now read the question.
This X-ray is terrible. It's like something's in the way. Mary, can you make out what it is?
Not really. Jane, could you ask the respiratory department to change their machines?
Oh, and whilst they're at it, the spirometers need a once-over too.
Spirometer? Is that one of those small grey things that you blow into to measure ventilation rates?
Sure, but they can do all sorts of spirometry reading these days. They can diagnose a lot of lung conditions, asthma, COPD, cystic fibrosis, pulmonary fibrosis. They're a very useful kit. I would have thought you'd remember all of that, Mary, or weren't you paying attention during our last interdisciplinary?
Hey, I don't specialise in chest radiography, you know.
To be fair, you don't need to. Never mind. I agree that the respiratory department should do something about their equipment.
That is the end of part B. Now look at part C. Part C. In this part of the test, you will hear 2 extracts. In each extract, you will hear health professionals talking about aspects of their work. For questions 7 to 22, choose the answer A, B, or C, which fits best according to what you hear. Now look at Extract 1. Extract 1, questions 7 to 14. You hear a radiographer, Greg Knight, giving a lecture on broken bones. You now have 90 seconds to read questions 7 to 14.
Hello, my name is Greg Knight, and I'm a radiographer specializing in broken bones in the UK. Broken bones can happen in any walk of life, but I would like to take a moment to discuss with you the symptoms, what to do when someone breaks a bone, and recovery plan. Broken bones are one of the most common injuries in the whole of the UK. Of the 40 million imaging tests reported in England during the year April 2015 to March 2016, 56% of those tests were X-ray tests. Most of these would have been checking for broken bones. In the month of March alone, almost 1.9 million X-ray tests were administered. The next most used imaging test is ultrasound testing, which accounted for 0.75 million of the tests administered in March 2016. A recent report from 2016 indicated that 7% of all sick days taken at work are due to a form of fracture or break. The symptoms of a fracture or a break can vary widely. In some cases, such as in compound fractures, the break will be obvious. In other cases, however, there may be little to no symptoms present. Usual symptoms, however, are as follows: swelling or bruising over the bone, pain in the affected area, pain during movement of the area and when pressure is applied, loss of function in area, and in some cases the bone will be visible. The bone will only be visible in extreme cases. These cases are known as compound fractures, whereby the bone protrudes out of the skin and is visible. This is also referred to as an open fracture. For this reason, a compound fracture differs from a closed fracture and is also treated differently. Once the skin is broken in a compound fracture, bacteria from dirt and other surrounding material may enter the body and cause infection. It is imperative that an open fracture be treated urgently so that the wound can be properly closed and thus infection avoided. In a survey taken in 2015, patients with a compound fracture who were seen inside 6 hours were susceptible to an infection rate of 12%. However, patients who were treated 6 hours after the event were susceptible to a 13.5% infection rate. Given their frequency, treatment for fractures and broken bones within the NHS is an extremely proficient network. In 2016, the median number of days between date of test request and date of test for X-rays was 0 days, whilst on average patients received the results on the same day 33% of the time. Treatment for fractures varies depending on several variables such as severity of fracture and area of fracture. A common treatment is a cast which holds the broken bone in place and thus encourages a correct recovery position whilst providing adequate protection from another damaging incident. One of the most severe fractures the patient can get is a skull fracture. There are open and closed skull fractures, depressed skull fractures, skull crushed inwards, basal fractures, fractures at the base of the skull, and linear skull fractures, where the fracture looks like a straight line. Treatment for these fractures can take months, but the pain normally lasts for only 5 to 10 days. Neurosurgery may need to be administered. Ultimately, most fractures are relatively minor, both in terms of their effects on your immediate health and in terms of their recovery time. Of the most common fractures, a broken arm takes 2 to 6 weeks to fully heal, 6 to 8 weeks to fully heal for a leg break, whilst a nose fracture takes a maximum of 2 weeks to return to normal. Most fractures in the healthcare world are more minor inconveniences than life-altering events, although there are still several types of fractures, such as compound or skull fractures, that can be life-changing in their nature.
Now look at Extract 2. Extract 2, questions 15 to 22. You hear a dentist, Lara Soft, giving a presentation on oral hygiene and tooth decay. You now have 90 seconds to read questions 15 to 22.
Hello, my name is Dr. Laura Soft and I'm a dentist who specialises in oral hygiene and tooth decay. My topic today concerns the oral hygiene in the UK and what can be done to help solve a growing problem in the UK healthcare industry. Oral hygiene in the UK is a serious issue. In the 24 months prior to July of 2017, just 51.4% of all adults in the UK had seen a dentist, totalling 22.2 million of the entire population. Although this figure was up by 18,000 compared to the previous year, health ministers in the UK are determined to see this figure one day hit 60%. The outlook is slightly improved for children, where 58.2% of all children saw a dentist in the 2 years prior to July 2017, an uptick on the 57.6% from July 2016. However, this number needs to be far better, as many of the oral medical issues that develop later in life are born out of unhealthy oral practices that develop in childhood. Approximately 57.5% of all dentist visits are for a minor checkup or treatment, such as an x-ray or polish and clean. However, a worrying statistic has emerged that in recent years, more children and teenagers are visiting the dentist to have tooth extractions. The statistic shows that from 2016 to 2017, dentists extracted around 43,000 teeth from teenagers or children. That is around 170 teeth being extracted per day. The process of tooth extraction involves a general anesthetic being administered and then at least 2 teeth removed. This number is up 17% from 2012 to 2013, the local government association announced. This upward trend is not only unhealthy, but it is causing an economic strain on the NHS. In 2012 to 2013, a total of 27.3 million was spent on removing rotten teeth in the UK, but the alarming trend has seen that figure now rise to £36.2 million. This drive rise in the number of tooth extractions can be heavily attributed to the rise in unhealthy oral hygiene and health in the UK. Tooth decay is avoidable. A healthy and balanced diet with minimal fizzy drinks, sweets and sugary foods in general will lead to less build-up of plaque and thus less rotten teeth. Furthermore, this diet will only be effective if you brush your teeth twice daily, once in the morning and once in at night, and floss after meals. These simple changes can drastically improve a person's oral hygiene and help to prevent tooth decay. The government is now taking tooth decay far more seriously. In a recent 2016, the government found that 1 in 4 children under the age of 6 suffer from some form of tooth decay, and that those children will have between 3 and 4 teeth affected. Tooth decay is not simply an economic inconvenience or a compilation of statistics. It is a serious condition if left untreated. Of those children under the age of 19 who had teeth extracted, 26% had missed significant time at school due to the pain caused by their tooth decay, whilst 38% had sleepless nights due to the pain, and 67% suffered significant pain. Those are alarming statistics and highlight why the government needs to make a concerted effort to encourage healthy oral practice. One of the best new plans the government has in place to deal with tooth decay is to discourage the consumption of soft drinks. Our diet should consist of no more than 5% worth of free sugars. In 11 to 19-year-olds, soft drinks, which regularly exceed our guideline daily sugar allowance in 1 can, accounted for 1/3 of all sugar intakes. But the UK government is encouraging healthy lifestyle diets and twice daily brushing far more than it used to. Hopefully this brings about a change to the UK population and especially to children who often have little to no say in their diet. Perhaps parents will take a greater notice of what needs to be done to improve oral hygiene.
That is the end of the listening test.